This is Healthcare Uprising. We are here to shine a light on the innovators implementing positive change in American healthcare and the patient experience stories, good and bad, that can help others navigate the sometimes overwhelmingly complex American healthcare system. Welcome to the Uprising. We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional.
I think for the longest time, and I feel like even just growing up, the idea of going to a nursing home was very negative, right? It was like this gross kind of terrible place to end up in, and someone's just going to drop you off and forget about you. But that's changed.
And we've all had, Girl Scout troops that, we went in and we sang songs or we did these things, and you're a little bit weirded out because there's just all these people there and they're in wheelchairs and it's something that you're not comfortable with.
Mm-hmm.
So the turn for skilled nursing and long-term care facilities to really become more residence-like has really helped ease that connotation of what nursing homes used to be.
What can we be doing to essentially help improve that quality of life for the various people that stay in these facilities?
Right. The number one thing that anybody can do is if you have a resident in a facility, go and visit them. It is just unimaginable how many people don't get visitors regularly, but it's so important for them, for their care, for their well-being, for their mental stability to have people come and visit them. So that's kind of on a personal level, but like I jokingly said earlier, we were talking about Girl Scouts coming in, but having those events and having people come in and just support those facilities, it makes a big difference in the lives of the people that live there. So that's a huge thing. And it's really challenging to recruit people to work in long-term care. They just don't think of it. Nobody graduates school and thinks, oh, I'm going to go work in a skilled nursing facility. Nurses, we need caregivers, we need people in the kitchen, people that will do the laundry, that kind of stuff. So one of the things that is improving and helping to get people to start paying attention more to long-term care facilities is you'll have programs in high schools that will do certified nursing assistant programs. So those people will come and learn and come into our facilities and work there for their practical, testing. They'll come, take blood pressures, learn how to work in the facility and get exposed to it. But also a lot of the facilities will train certified nursing assistants as well. So it's a great little career path. We always have a joke in our facility that we're more highly regulated than nuclear power plants because the regulations are just far and wide. They're everywhere. And so we get really inundated with that and making sure we're crossing every T and dotting every I. But when it comes to marketing, it's kind of an ignored part of what they're doing. And my belief is if we don't tell our story to the public, not just for recruiting, retention, but for the families that are looking for places for their loved ones, then they're not going to know what we're doing and the impact that we're having in the community. So I really believe that creating a marketing plan, putting stuff out there that talks about our facility and helps us build our brand makes a really big difference for the community. And it helps them learn and be educated about what kind of services we provide, just gives them a lot of basic information. I think that's extremely important.
Yeah.
Truth of it is a lot of people end up in the hospital from some kind of an emergency situation. They fell and broke their hip, something that they weren't planning. It wasn't like they were going in for a planned surgery. And then all of a sudden, them and their families are faced with, oh, you're going to need to go to a skilled nursing facility because it's not safe for you to go home. So all of a sudden, they have to try to figure that world out. And that's not a world that they're familiar with at all. And so that's why I believe it's really important to share our stories so that people can make, qualified decisions when they're looking at nursing homes and they're looking for a place for their loved one to go.
You provide some training. And you've got some great videos on your website. But let's talk about that a little bit in terms of the value that that provides to the staff or executive directors, and really, why are you doing that? Like,
Well,
what's your goal?
yeah, sure. One of the things I provide on my website, it's ltcwithmolly.com, is just some general frequently asked questions. Because I found that I was answering the same questions all the time. A lot of people don't understand things like the difference between Medicaid and Medicare, and then they don't know how to work through that Medicaid system. Unfortunately, if you end up in the hospital and you need to go to a skilled nursing facility and you don't have insurance that covers it, you can apply for Medicaid, but it might take 60 days for you to get approved for Medicaid. So all of that cost for those first 60 days are going to be incurred by you. And then hopefully you'll get approved for Medicaid and you'll get reimbursed, but that's not always the case. So I found that just providing some education for people was really a way for me to give back into this community that I've worked in for so long. I just felt like it was important. I felt like I wanted to make it easy. They're very short videos. I try to put the name of the topic in the video so that people know and they can say, oh yeah, I do have that question. Oh, how do I do that? Things like how do I pay my bill and how do I understand my bill, that kind of stuff.
This has been a Shut Up production.
Shut up!